Welcome to Let's Eat. I'm your host, Emily, holistic health coach and self-proclaimed wellness enthusiast, here to meet you at the intersection of physical and mental health, the exact location where optimal wellness lies. This podcast is meant to explore all areas of mind and body wellness, designed to offer you the integrative knowledge, behavioral strategies, and mindset shifts necessary to uplevel your health and feel better today. We'll explore nutrition, sleep, movement, self-care and stress management, habits and routines, gut health, mental health, and more. I am so happy that you're here. Welcome to the table. Let's eat. Hello, everyone, and welcome back to Let's Eat. I'm welcoming Dr. Tony Blasco to the table today. Dr. Tony Blasco is a functional medicine practitioner and a chiropractor. His story is really fascinating because he started as a chiropractor and then noticed that his clients were asking for more guidance beyond just relevant to his work as a chiropractor. So he decided to pursue further education. And as a result of that, he became a functional medicine practitioner. And now he has been in the health space for over 30 years. One of my favorite parts about what I'm doing in my work is being able to connect with other practitioners or therapists or doctors or, professionals within the health and wellness space that really align with my philosophy as it relates to health, and just having conversations with them. Networking is great, collaborating is great, but really just being able to say, hey, what do you see in your work? And how could we potentially work together in some capacity? Could I refer to you? And really just sparking conversation because of how passionate I am about this topic. It's really fun to be able to share that passion with others and talk about it and feel so strongly about it. And so that's really what I got to do when I sat down with Tony and had this conversation, and we explored functional labs, which I'm hopefully in the future going to be able to offer that to clients that I work with. It's been something I've been really, really interested in getting into, looking into programs and how do I become certified, or how do I become equipped in order to do that. So that's something that we explore, some of the more common labs that he offers and why it's not something that's offered maybe in traditional Western healthcare. We talk about digestive distress and why there's so much digestive inflammation. We talk about metabolic dysfunction and metabolic syndrome. For those of you who follow me on Instagram, I'm constantly talking about metabolic health, metabolic syndrome, blood sugar, support and management and what that means and how much of a crisis we're in that arena of health, and how 93% of us are metabolically unhealthy. And Dr. Blasco goes into that a little bit further. He explains what's happening on a cellular level and how he works with clients in mediating that and remedying that and addressing that at the root cause. And we explore, common issues that he's seeing in today's world: low glutathione, low omegas. He talks about nutritional support that you can immediately implement and make a huge difference in how you feel. And we talk about our healthcare system. We talk about it all, and it's really from a root cause perspective. And I love that. You know how I feel about that. That's completely in my arena of health and how I feel about health and my passion and my mission in health, both in a physical and mental health capacity. And it's truly just one of my most favorite things to do, is talking with others who share a similar passion and share something that really sets their soul on fire, because you all know that that's how I feel. So it was really such an honor to sit down with Dr. Blasco, and I look forward to collaborating with him, even referring clients to him. I will include all of his information in the show notes if you would like to connect with him or just follow along on social media. But I'm really looking forward to today's episode. So please enjoy my interview with Dr. Tony Blasco, and let's warmly welcome him to our table. Let's eat. Hi, Tony. Thank you so much for being here today. I'm really looking forward to chatting with you.
Thanks, Emily. Yeah, I've been looking forward to it too. It's been a few weeks since we talked, so
Yes.
I'm excited.
Yes, me too. So tell us about your professional journey to where you are now. Give us the background.
So I've been in practice for 34 years. I'm a chiropractor by license. So, the first 15 years or so was pretty much a pain practice, your typical chiropractic practice, neck pain, back pain, that type of thing.
Okay.
But as people started coming to me, they were wanting more from me,
Sure.
and I couldn't answer their need, their call for help. So I started to get into nutrition and things like that, looking at different chiropractic techniques and equipment and all these different things to try to meet their needs. And nothing was really hitting it until I got to the nutrition.
Okay.
And so, 16 or so years later, here I am, functional medicine, fast track. And, we just kept adding to what we do because of the needs of our patients. And also, personally, I was having children, 30 years ago, and my family's journey was changing as far as their health.
Right.
And we didn't want to go the traditional medical route with our children. So I had to come up with a plan. And
Yeah.
so that's kind of how I ended up here.
Wow. Okay. So when you started, you were simply in the world of being a chiropractor, and then you noticed that there were needs that weren't being met by your clients and the people that you were seeing. So you took it upon yourself to expand your offerings, and now obviously in the world of functional health. And so how have those two worlds collided for you in terms of chiropractic and now nutrition and functional medicine? Like how, or functional health rather,
Yeah.
how has that kind of come together for you in the practice that you're doing?
Sure. So I went to what they call a straight chiropractic college, and a straight chiropractic college back then was, all you did was adjust the spine, and everybody was going to be healthy. That's all you needed to do. You didn't have to worry about anything else because
Okay.
our innate intelligence would just take over. And when we freed up, subluxation or interference in the nervous system, life was going to be good. And I
Okay.
just found that after a while, that just wasn't true.
Yeah, sure.
The basis of it is beautiful, and I still believe that our body's capable of healing and adapting. But today's environment, the toxicity, the stress,
Sure.
even 20 years ago was really taking an impact or having an impact on my patients. So
Yeah.
they were getting more metabolic issues, they were coming to me with thyroid issues and weight issues, and they couldn't sleep, and hormones were out of balance, and I just didn't have answers for them. So
Yeah.
it was a collision. It was a big time collision
Yeah.
because I wanted to help my patients.
Sure.
And so I had to start investigating, different. At first, I went to different chiropractic techniques. Okay, I'll change from Gonstead to this or that. But I just was hitting a brick wall, and I wasn't getting answers from my patients. So, that collision was real, and it was eye opening. And then with my family, the same thing. When my kids were little, when it came to vaccines and
Mm.
treating them and all these different things, as children grow, I had to look for alternatives.
Yeah. Yeah. Wow. Okay. Yeah, and I think that, what I'm sure you've come across too, and you can speak to this a little, is, people coming to you as a chiropractor for joint and, skeletal issues of whatever capacity that might be. And I'm sure now, given your background and what you know, the manifestation of these issues could also be something that's not necessarily mediated by just being adjusted, right? Like
No,
the
not at all.
inflammation that's there from diet, from lifestyle, from whatever the case is not necessarily going to be as impactful, coming from your perspective as a chiropractor versus let's look a little deeper and why is there inflammation there that's causing this discomfort for you. So you taking it upon yourself to go a little bit deeper in terms of expanding your ability to serve these clients, was almost essential if you were actually going to see the shift and the progress that they were looking for. Um, because what work you were doing as a chiropractor was not covering what was actually going on, if that makes sense.
That's right. Yeah, it does. I had to make a decision. Do I stick
Yeah.
in just in the chiropractic lane and just tell these people to go elsewhere? But as you know, as you develop relationships with people, they begin to trust you and they come
Yeah.
to you and they're like, I don't want to do the traditional medical route. You need to
Sure.
help me.
Yeah.
And so I was almost forced to do it in a certain
You just
way.
had no choice.
I just had no choice.
Yeah.
And then the same thing with my family. My children, we wanted to bring them up holistically and teach them those values and the way
Yeah.
to approach health.
Sure.
And it wasn't happening with their medical, with their pediatrician and things like that. So yeah, it was, I don't want to say I went into it reluctantly, but I was kind of
Yeah.
forced.
Yeah. Well, thank goodness that you
Yeah, right.
decided to
It's a
do it
blessing.
though.
Yeah, it
Yeah,
was a
for
blessing. Yeah,
sure.
it's a blessing.
Not
Yeah,
only
absolutely.
for your personal, journey and for your children and your family and so forth, but also for the work that you do. So that's so valuable. So what types of issues do you primarily see in practice? What are you coming across nowadays?
Yeah, wow. I mean, everything, right? And
Yeah.
people come to me just about everything. Just
Yeah.
this week I had one patient with ALS, I had another patient with
Mhm.
diabetes, someone else wanted to lose weight. Someone else just had pain. Someone couldn't sleep. These are the new people that I'm talking to each week. So
Yeah.
it's kind of across, the spectrum, but it all boils down to the essentials.
Yeah.
We deal with a lot of cellular health and then inflammation that you spoke about, diet, obviously, digestive issues. Um, so I see a lot of things. I just
Sure.
had a child in here with ADHD yesterday that it was really cool. He's like 12 years old and he told his mom, I want to do holistic medicine. I
Oh
want to
my
do,
goodness. I
and he's
love
12,
that.
right? 12. And I was like, oh, this is so cool. I'm like, how do you,
Yeah.
he goes, well, I like plants. And I'm just, he was doing his own little
Oh,
investigation. And,
cool. Yeah.
and his mom goes, yeah, he wanted me to call you. So,
Okay. Very
yeah,
cool.
so that was kind of fun. So, yeah, so just across the board.
Yeah.
Um, but as you know, like I said, it comes down to those main factors
Yeah.
that we'll dig into in a little bit, I'm sure, of cellular inflammation, digestive issues, and things like that.
Yeah, for sure. And, you know, I think one of the best things that I heard probably in the past couple years through my own self-education and exploring and looking in the research and so forth was something that Dr. Mark Hyman said, and he essentially put it into perfect perspective on how all of these issues really are just inflammation manifesting in different ways in the body based on who you are, based on your genetic makeup, based on, different factors that are individual to each of us, and they're just showing up as symptoms in certain parts of the body. And so what you're saying,
Sure.
like those basics, now that's not a cure-all by any means, but really looking at those basics that you mentioned and addressing those first and foremost, not only is that the only way to go about it, right? Because you can't expect someone to do these, overly intense protocols if the basics of nutrition and so forth aren't addressed first and foremost.
Right.
But, looking at those right off the bat can completely transform someone's health no matter what issue they're facing because of the
Sure.
fact that it really does come down to this is inflammation. I'd love for you to
Absolutely.
speak on that a little.
Well, there's been times where we're waiting for labs to come back from our patients. So it takes, 3 or 4 weeks to get some labs back. In the meantime, we start people off on elimination diet a lot of the times, just
Okay.
trying to find those inflammatory foods, in their diet.
Sure.
And sometimes before we get their lab test back, they're feeling so much better.
Yeah,
And all
yeah,
we did was
yeah.
change, their diet, maybe a couple lifestyle things. So it has a huge impact on people's health.
Totally.
Um, so and then I say, okay, you can start to introduce some of those foods back in. They're like, no, do I have to? Can't I just stay away from them? And I'm like, yeah,
Yeah.
well, that's your choice, whatever.
Yeah.
It's a huge impact. And it's just fun, just some simple lifestyle changes, the stacking the hacks on top of one another, really
Yeah.
simple things can make a huge difference, before we get any labs back
Yeah,
a
yeah,
lot of times.
totally. Especially given the state of the modern world and the
Yeah,
lifestyles that the majority of Americans are leading, just making small changes in that regard. I mean, that can completely change how someone feels. And, hopefully that's encouraging to someone who is maybe in the midst of symptoms or diagnoses or whatever the case may be, just starting somewhere and making these small changes actually can have a profound impact on how you're feeling and really start you in the right direction.
absolutely. Like just eliminate gluten,
Yeah,
it's huge for many people, and
sure.
they don't realize it and all the places they gluten is hidden and they're
Yeah,
not aware that they're even eating it, so it
sure.
has just a huge impact on them.
Yeah, absolutely. Couldn't agree with you more. So I would love for you to share a little bit more on the difference between conventional healthcare and what is more functional. So giving kind of your maybe definition explanation on what it means to take a functional approach to health and what that means in your work.
Sure. So, to me, it's finding that root cause, and you probably hear that, thrown around a lot, that term nowadays, but it's really true. It's finding the root cause, a lot of times inflammation.
Sure.
Traditional medicine, allopathic approach to health is treatment centered.
Yeah.
It's not preventative.
Yeah.
It's get sick, then you come see me type thing.
Yeah.
I even find, unfortunately, some medical doctors that aren't willing to do tests that I
Mm.
recommend for my
Hmm.
patients. They send
Hmm.
back to the primary care or what have you. They just are in a box and they can't go outside the box because they're owned by the hospitals and
Sure.
dictated by the pharmaceutical company and insurance company. So they're kind of stuck. And these are doctors are good people.
Yeah.
They're just kind of stuck in a system. So the main difference is that holistically or functional medicine, we're looking at the root cause of the issues on a cellular level, typically. We understand that we have to, we call it peeling away the layers of an onion when we're dealing with
Sure.
somebody
Yeah.
because it has built up over time, depending on their age and, like you said, their genetics and
Yeah.
epigenetics and all these things.
Hmm.
So really focusing on the whole person and not just an organ, system.
Yeah.
So you go to allopathic approach, you go to the cardiologist and
Yeah.
rheumatologist, and oncologist, whatever, uh, but they never talk to each other.
Yeah.
Never talk to each other. And so many times, even in my own family with like my mom, she had so many doctors, I had to like fire them all because they wouldn't talk to each other. They refused. Literally refused. I'm like, could you call the
Yeah.
cardiologist? Or yeah, they're like,
Yeah.
no, we don't do that. We just
Yeah.
like this is amazing. So whole person approach, physically, emotionally, spiritually, really getting to know them, really understanding, their genetics, their epigenetics, and just finding a pathway for them because it's different for everybody. Even though those
Yeah.
foundational things, we talk about are the same,
Yeah.
but the journey is different for everybody. So I think that's the biggest difference. We listen. I have at least 30-minute appointments or
Yeah.
60-minute appointments and not 7-minute appointments.
Yeah.
That you get, and we get to know people really,
Yeah.
really, really well. And I think that's the biggest difference. I was just talking to my nutritional therapist Samantha yesterday, and she goes, I think this patient just wants to talk to us every week. I'm like, yeah, that's all they want. They just want to have someone to talk to because we,
Yeah.
we listen and we understand. And I
Yeah.
have that all the time. I'll tell someone I'll see you, in a month or 2 weeks or whatever. Like, oh, can I call you next week? Can we talk next week?
Yeah. Oh, so you're
We
like a
could do that.
therapist, it sounds
Yeah, yeah,
sounds
yeah.
like.
Well, that's your world, but
Yeah.
perhaps, but not our world. But yeah, we feel that
Yeah.
way. We feel that
Yeah.
way sometimes. But that's what they need. Sometimes
Yeah.
they just need someone to listen to them, right?
Yeah.
Talk to them about their health and so forth.
Yeah.
But I think that's the biggest difference. We just
Yeah.
accept people where they're at. We don't force them into the situation. We guide them.
Yeah.
We look at all aspects of their life and not just, their symptoms.
Yeah, yeah. And, obviously I'm biased, but I would argue that's the more effective route of care.
Right?
Now, I
Yeah.
know that time and money is also a factor when it comes to maybe the more conventional approach to
Hmm.
healthcare that we see in Western
Sure.
medicine.
Sure.
So I understand, without getting too political into that world of things. Um,
Yeah.
I get it, and it is what it is. But what it sounds like too, and this is actually something that I've experienced, and a client of mine comes to mind is, she was never validated in her experience, and now we're speaking on someone who has been sick for many years, lots of autoimmune, lots of gut issues, just the list is just on and on and on, starting when she was 20 and now she's in her 50s. And, she's just never felt like she had that validation coming from our
Sure.
healthcare system, and no one
Yeah.
really knew what was going on. And it's on your head type of language that was being
Yeah.
used. And
Yeah.
I'm so grateful that even though I'm not a medical professional by any means, I still was able to give her that space to say what you're
Yep.
feeling is real and it's okay. And
That's right.
there is healing. It's not going to be tomorrow, but maybe down the line. And, investing in this process is really what will get you there. And that really was so profound for me to be able to offer that for her, but just on her own journey, how pivotal that was for her mindset and her
Sure.
ability to have hope in the potential for healing. So it sounds, they're similar, kind of similar to what you're saying around, people just wanting to talk and people just wanting to be heard, how
Yeah.
important that is for someone along a journey to feel like, yeah, this is really hard and this does suck. And I do have space to heal. I do have the potential to heal through investment and through time and testing and so forth. But without that, I think it just plays such a massive role on our morale and our, and our, I keep going back to the word hope, but that's essentially what it
Sure.
is, the hope that we have in the process. And I think a lot of us have lost that because our healthcare system is
Absolutely.
not doing a good enough job
That's
at
right.
validating,
That's right. That's right. And I believe, that hope, that belief that they can heal like you said, it's not there. And sometimes that's the first step we have to bring out, that
Yeah.
they have to understand that they're actually capable of healing,
Sure.
regardless of what they've been through, regardless of their history, regardless of the genetics.
Sure.
They're able to heal if they believe that they can. So
Yeah.
that belief, we try to encourage our folks, you have to believe this,
Yeah.
you have to trust me a little bit here, but
Yeah. Yeah. Yeah.
you just
Yeah.
have to believe that your body's capable of healing. And you know, that's my belief, is that, God created the perfect body capable of
Yeah.
healing and adapting if
Yeah.
we will just feed it properly,
Sure.
and get rid of the toxicity and the stress and all these things that, slow us down and create disease.
Yeah.
When I was in chiropractic college, they taught us there's three things that cause subluxations, misalignment of spine, creating interference. One was stress, the
Mm.
other was toxicity, and
Mm.
then lifestyle, like physical things, obviously. And
Sure.
everyone always thinks when your back is out, oh, it's a physical thing. But more people saw me for chiropractic because of toxicity and stress than, they picked up the laundry basket or they were in an accident. But they don't understand that, or they didn't understand that until I shared
Yeah.
that with them. And that moved perfectly into functional medicine for me
Yeah.
from that chiropractic, world. I was like, hey, these are the same stressors on our body that I've
Sure.
been dealing with for the last 16 years. Now I'm going to just deal with them a little bit differently.
Yeah. 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 I love that. And kind of that segue to some extent from where you were and then now what you're
Yeah.
doing, the
Yeah.
overlap that's there. Are you familiar with Louise Hay? Are you
I
familiar
am
with the
not.
author? So
No.
I'll just as kind of an aside, based on what you were saying, that belief system that you can heal. She is a pretty well-known author. She wrote the book You Can Heal Your Life. I 10 out of 10 recommend it. It's such a powerful book. And
Cool.
she talks about that, how her own journey, she was diagnosed with cancer and this whole experience about how our thoughts really do make a huge difference in our belief
Sure.
system around our body's ability to heal, it plays a massive role. Now, that's just another illustration of the mind-body connection and how powerful our
Right.
thoughts are on our bodies, um, on our organ systems, on our nervous system. I mean, the list goes on.
Everything.
So
Right.
I would recommend that to you
Cool.
absolutely because of what you're saying and kind of the work that you're doing. But I love that you said that. Our bodies have the ability to heal. They know what to do. They know how to do that. We just have to
That's absolutely
give them the means to do that and
to
the
do it.
resources and the nutrition and the nourishment and so forth in order to do that. And I think we become very frustrated and angered at our bodies and feel betrayed by them in a lot of ways,
Right.
and in reality they're just doing the best that they can with what they have. So giving ourselves
That's
some
right.
grace, that is also a way to manage the
Big time.
stress that comes along with getting sick or feeling
That's
sick,
right.
and because we know, obviously, you and I have spoken on this, just the impact of stress on the body as well.
Right. Absolutely. And giving people permission to heal. Sometimes people, their illness has become their life.
Yes.
Right. And then
Yes.
and they can't let go of it because maybe that's how they get attention from their spouse or their children or
Mm-hmm.
whoever,
Mm-hmm.
or social media, whatever it is. And then you have to kind of break through that also and give them permission, say, hey, you're allowed to heal. You're allowed to be
Yeah.
okay.
Yeah.
Regardless of what anyone has said to you or what you've tried before, and I find that for some people that's, they don't they don't realize it's okay to be healthy.
Yeah. And it's like the
Yeah.
self-sabotage
Yeah.
process, I'm
All
sure,
the time.
resistance that you notice, but it's maybe they're not showing up to their appointments or they're not able to successfully implement something that you've suggested. And that definitely
Right.
can, I notice this a lot as a therapist, it's bringing your awareness to what's not being said and bringing your attention to it when people are resistant to making a change or, what
That's
that
right.
means for them and their identity. I mean, huge, huge, huge,
Yeah.
huge. Yeah.
And I just had a woman yesterday, like I talked to her 2 weeks ago. She was supposed to start her supplements, and we talked how to do it and how you should do it and implement it. And we got on the phone yesterday. I'm like, so did you take your supplements? She's like, no. I'm like, can you tell me why? And she didn't have an answer, but
Yeah.
I knew what the answer was. And
Yeah.
she just didn't believe it was going to work for her
Yes.
in her
Yes.
particular case. Right. So, you don't beat them up and, I'm like, okay,
Hmm.
so we're going to talk in 2 weeks and
Yes.
let me try,
Yeah.
but it's just because she didn't believe that
Yeah.
taking the supplements were going to be helpful,
Yeah.
because
Yeah.
it's never been helpful before for whatever reason,
Yeah.
and now,
Yeah.
but now it will be. Now it will be.
Yeah. Yeah. And that's another point, is seeing the value in what you're doing. And I love that
Right.
you encourage clients in that way of saying you just have to trust me, you have to believe me, because these methods of health are culturally not what we're used to. And so I think there is some skepticism and resistance to it because number one, it's new, it's different, it's not comfortable necessarily. And it's just different from what we know. And we're used to going to the doctor, getting a medication and leaving and we're on
Right.
our way.
That's right.
And
That's
so
right.
for us to then tell someone, okay, you need to change this about your nutrition or implement more of that or whatever the case is, it can be really daunting. And what you're saying is if there's not a belief in it or there's not I see the value in this, then
Yep.
it's going to be much harder for someone to implement. And that's just
That's right.
basic human drive, a
Sure.
motivation, you
Sure.
know?
And the fact that our techniques are really thousands of years old. We're not really
Yes.
doing
Yeah.
anything different, right? It's been around for a really, really long time.
Right.
The
Right.
approach. And then, it's changed. Obviously, we
Yeah.
have more technology in the labs and all these wonderful
Hmm.
things, but the approach is really no different.
Yes.
It's the same
Yeah.
basic thing it's been for a real long time. And it's kind of
Yeah.
getting back to those basics for a lot of us, if that's possible in today's world, to
Yeah.
heal. Yeah.
Yeah. I know I heard someone say the other day, maybe it was on a podcast, they're like, Western medicine should be considered alternative medicine,
Right.
not alternative medicine as like functional holistic wellness. Like this has
That's
been
right. That's right.
long before we had any kind
That's
of
right.
antibiotic or anything of that nature.
That's
This is
right.
what we were doing.
Yep.
So we've got it
Absolutely.
a little
Yeah.
backwards
And
here.
like organic food is the newest thing. No, it's been organic for a
Yeah,
really long
sure.
time, and
Yeah.
then
Now
we
it's just mass
ruined
produced.
it.
Yes,
Yeah.
exactly.
In the
So
last 100 years.
yes, yes, so true. So true. So you mentioned something about labs, and so I want to kind of transition into labs, functional labs.
Sure.
Tell us about what that looks like for you. What are functional labs? What are the most common ones that you're running with clients? Why aren't Western health professionals implementing similar lab work?
Yeah.
Give me the lowdown.
Yeah. So, just to go back on Western, I'm not against medicine. I
Yeah,
mean, it will save your life. If you, get hit by a truck, you have to have surgery, man. We have the best medicine out there for
sure.
that. But it's in the preventative arena where I consider they're failing. But the difference between functional labs and traditional blood work, it's just what it says. It's looking at function. We're not just looking at how much, vitamin B12 do you have in your blood. What is your body doing with that B12?
Sure.
Because it plays so many roles in amino acid production and blood sugar regulation, and all these different things that we need, digestion. So we want to look at things from a standpoint of how is your body functioning. So all our labs are based on that. So some of the main ones I use are GI map test.
Love
So
that.
again, it's looking for, infections and dysbiosis, and it doesn't look at SIBO, but it can give us an indication, and there might be some SIBO going on there,
Okay.
yeast overgrowth, things like that. But there's a big section on function. How's the
Yeah.
liver functioning? How's it? Are you producing enzymes? How's your immune system? How are the detox pathways? Do you have leaky gut? What's your gluten sensitivity? All these functional things that I need to know to
Sure.
help, which you're not going to get from traditional medicine. And they're just not going to go there. They may do a stool sample, but they're basically looking for infections.
Yeah.
And that's fine, but they're not looking at the function of the gut. So, from a gut standpoint, those tests, and there's GI effects test is very good also. But I happen to like the GI map test. We use the Dutch test and the whole series of Dutch tests because they're like this gold standard of testing, I believe, of hormone
Sure.
wise. So looking at adrenal testing, cortisol awakening response, estrogen, all the sex hormones, but their metabolites, again, how are they used in the body? Not just how much do
Mm.
you have,
Mm-hmm. Mm-hmm.
which is important, but how are they being utilized? And also, like for estrogen, the detox pathway of estrogen,
Yeah.
it's not just you're making estrogen, but are you getting rid of what you're not using? Because we
Yeah.
only use about 5% of that, right? So how does the body do that well? And that gets us into methylation and the COMT
Mm.
enzyme and all these different pathways and organic acids, that are important, neurotransmitters, and all these things that complement how estrogen is used or how testosterone is produced and things like that. So we
Yeah.
get so much more detail from these tests than just circulating, estrogen in that example. My favorite test, however, is the NutriVal
Okay.
test, which basically looks at the entire Krebs cycle. So we
Okay.
see everything from the metabolism of carbohydrates and fats and proteins, entirely through the Krebs cycle, your omegas, your amino acid function, toxicity, minerals, there's 150 markers on that test
Oh my
we look
goodness.
at.
Okay.
So when
Very
I when
cool.
I do those, yeah, when I do those three tests, GI map, some form of Dutch testing, and then the NutriBiow test, I have so much information about this person
Sure.
that they had no clue was going on in their body.
Yeah.
No clue was going on in their body. And it's so
Yeah.
powerful.
Yeah.
Sometimes there's too much information.
Yeah.
You know,
Right.
what
Like,
do
where
you
do we
do with all that
start?
information? Yeah.
Yeah.
But that's my job. That's my job to kind of sift through it for the client or patient and make suggestions, try to make it simple, take one
Sure.
step at a time. But so those are some of my favorite tests. I mean, there are many others. I do some DNA testing when needed.
Okay.
Uh, and then doing DNA tests, matching it up with the NutriVal test is very powerful. So if I find a SNP, let's say in methylation, then I can go look at the NutriVal test and say, hey, you are methylating okay. So even though you have the SNP here, your body's overcome that through, things that you've done well in life, whatever
Okay.
that is.
Yeah.
So it's very powerful to put the two up against each other and see how they're manifesting.
Sure.
Yeah,
Yeah. Wow. And, it kind of puts traditional blood work to shame a little bit when we're looking at what you're
big time.
what you're offering.
Big
So
time.
let me ask you this. So
Yeah.
you had mentioned briefly before about, and this is something you and I discussed, kind of the box that these healthcare professionals are in terms of offering blood work. And the issue that I find, in my personal experience, especially now that I've become so much more informed and educated also, and then also, when working with clients and having this kind of third party professional that I am working with, not directly, but indirectly with through the
Mhm.
the client, their requests are often dismissed and they're kind of sent away, right? Where,
Yeah.
oh, I'd like to have a full thyroid panel, or I'd like
Right.
to, look at X, Y, or Z for the sake of understanding whatever the specifics are. And really just having no luck. More often than not, clients are not getting that, and they're not being heard, they're not being validated, as I mentioned, right?
That's right.
And doctors are kind of just dismissing them and their requests. Now, I get there's an insurance piece to it. I get that
Sure.
maybe certain labs are maybe lesser traditional, say like testing. This is something that I've been really passionate about is testing our fasting insulin versus just your fasting glucose, right? And really
Correct.
kind of taking it a step further, but I'm
Right.
just wondering your thoughts on this and kind of, anything that you've seen in your practice that's been more effective in that arena, or, do you suggest that they find a practitioner who is willing to order these labs? I mean, I just want to hear kind of your thoughts because I come across this and I share this with you. It's just like hitting that wall, hitting that brick wall where,
Yeah.
I can only do so much to support them in this process. And our healthcare system really makes it challenging for them to get what they want and get what they're looking for.
Yeah, absolutely. It's very frustrating. And I feel bad, particularly for women, women 30 to 45, 50 years old who are really struggling. And I'll have them go to their, primary care OBGYN and ask for a panel, hormone panel, and they'll refuse. I
Yeah.
mean, time after time after time. It's your choices are you go on birth control
Mm-hmm.
or you go on antidepressant.
Mm-hmm.
Because we're not going to test your hormones because they're going to be fine. And, what it doesn't really matter.
Yeah.
And I can't tell you how many times I've heard that story and actually had women crying as they're telling me that story because they're not
Yes.
being heard. And it's so frustrating. So I basically just don't find another doctor,
Yeah. Yeah.
because there are really good doctors out there that are willing to do panels. You just got to find them.
Yeah.
Like you said, complete thyroid panel. They refuse to do reverse T3 because it's not important.
Right.
Well, it's important to me.
Yeah.
I need to know the whole pathway of the thyroid hormones, right? Is it
Yeah.
getting into the cell or is it not getting into the cell?
Yeah. Yeah.
That makes a difference on our support protocols. So it's very frustrating when doctors are like that. So, but they're out there. You just have to find them. You just
Yeah.
have to search and ask hard questions. And if they're not, working with you, then you find another doctor.
Yeah.
And that's not easy. I understand that, but that's what you have to do because it's very frustrating.
Yeah. 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 I agree with that. I think, like you said, and luckily I chose to find another doctor as of last year. And I'm so grateful that I have because
Yeah.
it's completely changed, my ability
Yeah.
to access certain things and understand
Absolutely.
my health better. Yeah. But it's hard. And I'm so glad that you mentioned the whole, birth control or
Yep. Yep.
antidepressant,
Yep.
and
That's
these
it.
are the options. And it's
Yeah.
it's it's because like you had said before, it's not that these individuals are bad people, but they're following a rule book that is rigid and needs to be followed, and it
That's
is what
right.
it is. And
Yep.
that's the fact of the matter. So the only option that we really have, if we really are you know, urgently seeking these tests is to find someone who will administer them. And like you're saying,
That's
they're
right.
out there. It just takes some time. And I think
Take some time.
we've been told just trust the doctor, listen to the doctor. And like I've always
Right.
said before, both now in this conversation, but also just in general, I don't want to discredit or, there's no, malintent behind saying this, but, you know, you are your own best doctor. And so if you
That's
know
right.
that something's not right and you're feeling it and you feel called to be tested because of your own research or because you're feeling a certain way, your symptoms look a certain way, whatever the case is, I say this time and time again, do what you have to do to do
That's
that,
right.
to get there.
That's right. That's right.
Just giving up the first try, maybe give it a go again, because
Yeah.
like you said, there are people out there that will do that for you.
Absolutely, there are, and I love working with these doctors. I mean, or alongside them, I should say, because they have expertise I do not have.
Yeah.
And we need them to
Yeah.
work with us to
Yeah.
help, so we can make sure we're doing the right things for our clients.
Sure.
So when I find those doctors, it's a blessing,
Yeah.
and
Yeah.
and again, we need them. We
Yeah.
absolutely need them, and I require my clients to be seeing a primary care doctor, because
Yeah.
I'm not a primary care
Sure.
doctor. And I don't play one on TV, so
Yeah.
I can't even go there or anything. So, you know, it's important that they have that person, in their back pocket, so to speak.
Yes.
And we could really, and we need them, and it's
Yes.
important. So, but it is very frustrating, and it's very unfortunate because a lot of times
Hmm.
it's a brick wall that we hit.
Sure. Sure.
Yeah.
So on that note, let's explore metabolic syndrome, metabolic dysfunction, what that means, what is happening in I'd like to say world, but I guess more specifically what's happening in our country, because I
Yeah.
think we're seeing it at incredible rates. And what's going on as a result of these issues. You talk about cellular function and getting down to that cellular level, and I think this is kind of all embedded there. So I just
Yeah.
would love for you to share more on it.
Well, we're being poisoned, first of all, right? I mean, it's
Yes,
just
to
the
put
way
it
it is,
simply, yes.
We're being poisoned with our food, and also, seed oils in particular are a real problem, not to mention all the toxins and, preservatives and things like that. Stress is huge.
Sure.
I think more people see me because of chronic stress than anything, particularly since COVID and
Yeah.
everything that people went through there. So yeah, we are just being our cells, our cell membranes in particular, those lipids are being destroyed.
Hmm.
And when you destroy the lipid layer of the cell, not to get too technical, you don't stand a chance. You're going to have
Mm.
metabolic syndrome.
Yeah.
And I see this when we do our NutrIval tests. We see this. I mean, people are deficient in omega-3s, big time deficient in omega-3s,
Sure.
and they have high what we call lipid peroxides. Basically, they're breaking down those fats, and that's the gateway in and out of the cell. So
Okay.
nutrients can't get into the cell, even if you're eating healthy.
Yeah.
People still have metabolic syndrome. They're not, and they're eating healthy and doing all the right things because their cells are being damaged
Yeah.
because of prior diet or stress or what have you. So, when I look at metabolic syndrome or metabolic diseases, I try to look deeper into the body and we do the insulin and all that. That's important, right? We need to know these things, inflammatory markers and things like that. But most people are deficient in glutathione production,
Yes. Oh yeah.
right? And antioxidants. They're not getting
Mm-hmm.
them in their diets, creating a lot of oxidative stress in their body, and
Sure.
and that leads to metabolic disease and metabolic syndrome. And it's
Yeah.
rampant, I think just because of seed oils in particular,
Yeah.
and that people don't have the right healthy fats in their diet,
Yeah.
and then that stress level, and
Yeah.
so that's what I see. And I know there's more to the ball game than that. But I think when I do my testing, that's what I see time and time again. I see
Sure.
low glutathione levels. I see low omega levels, omega-3s, sometimes higher omega-6s, but not always. That's a little shocking. You would think
Okay.
you'd see higher
Higher.
omega-6s,
Yeah.
but I don't always see that.
Okay.
Um, so the omega-3 index is a good indicator, not the omega-3/6 ratio.
Okay.
So that omega-3 index is the key there. But I think that has a devastating effect on our metabolic rate. And then, our B vitamin, a lot of people
Hmm.
are deficient in B vitamins. And if you look at that Krebs cycle, that's the beginning of the cycle. We need
Yeah.
those,
B vitamin.
for
Yeah.
utilization of carbohydrates and fats and things like that. So those are the biggest areas I see that are affecting and creating metabolic stress to our bodies. And
Okay.
then the diseases are rampant. You name the disease, it's out there. But from a functional medicine standpoint, that's where I'm looking. I want to get that deep into the body and fix those things if I can.
Yeah. Okay. Yeah. I mean, it's just so it's so incredible how common this is that, to the point of people have no idea that even that this is going on. I think
No clue.
84% of Americans are pre-diabetic and don't know it. I think 93% of Americans are metabolically unhealthy, which is what you're
Yep.
referring to.
Yep.
So when it comes to what you were saying about, and like you said, not to get too into it, but having, the membranes, the cellular membranes damaged, right? Like, and then
Yeah.
people thinking like, well, I'm doing all the right things, which, oh my goodness, I hear this all the time. Well, and more in relation to weight loss, but I'm doing all the right things and nothing's happening or nothing's changing. I'm not feeling better. There's no improvements, whatever the case is. I'm sure every person is specific and, has different individual needs based on their specific circumstances and testing and so forth. But where would you even begin to repair and to work on healing that part of someone's health, and
Sure.
if they're doing all the right things, and I say that in air
Right.
quotes, right? Because we hear that all
Yeah.
the time, and then you see what they're doing, and maybe it's not so much all the
Not
right
so
things.
much. Right.
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 But, how do you even get started there? I'm just out of my own curiosity.
Yeah. So again, depending on their test results, right? There may
Sure.
be very specific areas that we need to focus on, but the basics. Let's make sure the diet's right. Make sure they're getting enough fiber in their diet. Make sure they're getting enough antioxidants in their diet,
Yeah.
polyphenols in their diet. Are we feeding the gut or are we destroying the gut? Those
Yeah.
basic things that we need to do.
Sure.
When it comes to glutathione, that throws me off all the time. Majority of the people are low in glutathione. I mean,
Yeah.
across the board. I'm not really sure where that's coming from.
Yeah.
To be honest with you, I don't know if it's a liver issue, just toxicity,
Yeah.
but I just see it across the board almost, I would say 75% of the time,
Right.
there's two things that stand out. One is low glutathione, and their omega-3s are just not there. Like
Yeah.
sometimes not there at all.
Okay.
So but just getting the basic things right. And then, exercise and sleep and stress
Yeah.
management, all those things that we know will reduce oxidative stress levels and inflammation and give their body a chance to heal. And then
Yeah.
depending on their test results, taking specific action for that particular client, whatever they need,
Sure. Okay.
wherever their needs are.
Yeah. Yeah, that's super fascinating. And interesting about the glutathione piece too. I recently started supplementing, I guess not recently, it's probably been about a year now because I learned more about my genetic makeup and my detox pathways and
Right.
methylation and all that good stuff. So
Right.
I started supplementing with it, but I was largely unaware of what it was really for up
Sure.
until maybe a year and a half ago, 2 years ago, and then learning more
Right.
about its importance and its role. And
It's huge.
yeah, yeah. And then
Yeah.
omega-3 conversation, that to me is something I'm very passionate about, especially as it relates to brain health and mental health and
Yep. Yep.
how the ratio of omega-6 to omega-3, how imbalanced it is, and
Yep.
how deficient we are in omega-3s and the influence that has on, obviously inflammation. And it's just, yeah, so important. So I'm glad you
So
touched on
important.
those
Yeah,
because those
so
are important.
important. Yeah, the
Hmm.
glutathione I think is missed by a lot of, even holistic doctors or practitioners. Um, Again, like you said, I wasn't aware of how important it was till, for me, maybe 4 years ago.
Sure. Yeah. Yeah.
First of all, we didn't really have testing that we could find it,
Measure it. Okay.
and now we do, and now we can measure it. And so it's I just again see it so consistently low for so many people, and we can get it high pretty easily. It's
Yeah.
not that difficult. We can
Hmm.
supplement that and get it up there. So, but yeah, the omega-3s and glutathione are probably two of the biggest things that I see foundationally that we need to help people with.
Okay. Do you know if, and this you might not know this off the top of your head, if somebody were to go to their primary care doctor, could they ask to have their glutathione checked?
That's a great question. I've never seen it on a test.
Okay. Yeah, I was gonna say I certainly have I certainly
No,
didn't. Yeah. Okay.
yeah.
Yeah.
So there's a couple markers. One is through blood and one is through urine.
Okay.
That we look at. I mean, just pure glutathione is one,
Okay.
uh, and polyglutamic acid is the other one that we look at. So it depends on are they both low? Is one low? How we'll supplement for that. It just
Okay.
depends.
All
Yeah.
right.
Yeah.
Interesting. So how about digestive inflammation? because we know that that in and of itself is a spectrum that is, I think it runs rampant in our country from, just general indigestion and stomach discomfort and having trouble, with digestion, absorption, and so forth, all the way to more extreme issues like colon cancer and whatnot. I would love to just hear what your thoughts are on that, what it looks like for you in your work. Are you seeing an increase in people coming to you? What's the deal?
Yeah, I mean, the deal is it's horrible, what I
Yeah,
see out there with digestion. And what's remarkable about that is that sometimes people don't even have digestive symptoms.
sure. Yeah,
They don't know that it's digestion is the issue. But I think the biggest thing I see, and again, when we do our testing, it's kind of surprising. I don't see a lot. So we have a marker called calprotectin, which tells us about inflammation. I don't see that marker high a lot.
okay.
What I do see high is zonulin, which is a marker for leaky gut.
Yeah,
Big time, cross the board again. One of those things we just see a lot of leaky gut,
yeah,
a lot of dysbiosis in
sure.
there, and then particular probiotics may be low. Akkermansia has gotten a lot of publicity lately.
Yes, yes.
And I find that marker, particularly with COVID and COVID vaccines, to be kind of wiped out on a lot of people.
Mm,
And of course, that's large intestine, colon. That's where that kind of is housed. And so taking care of those situations is really important when we get very specific with it. But in general, gut inflammation, leaky gut, uh, that mucosal layer being destroyed through
sure.
stress because of high cortisol levels from chronic
Yeah,
stress or antibiotic use or over antibiotic use, I should say, or other medications that destroy that mucosal lining. And then, once we have leaky gut, then that just creates that inflammatory response.
yeah.
And also oral health is really important. A lot of people
Mm-hmm.
neglecting their oral health, just not using helpful toothpaste and things that are destroying the microbiome of the oral cavity. And then stomach health, we see a lot of H. pylori,
Yeah,
and that
okay.
and that creates a lot of distress. It lowers the pH value or raises the pH value of the stomach acid. So, it starts, digestion is an above down process.
Right.
So the higher we go up, that's where we like to start. So is there a oral microbiome problem? Is there a stomach issue? Is it intestinal, liver, pancreas, the whole bit? To just kind of work our way down through those pathways and try to figure out where's the source coming from,
Mm-hmm.
and then helping that person at that level, whether they
Yeah.
just need better oral hygiene or, is it lower in that colon area where we need to target, particular things. SIBO, I don't do a lot of SIBO testing, but we
Mm-hmm.
do find it from time to time.
Okay.
Um, but mainly it's just those basic things that I just mentioned that we find out of balance, and that
Yeah.
leaky gut is huge,
Yeah.
and then
Okay.
creating more systemic inflammation, not just GI inflammation.
Sure. Yeah.
Yeah.
And, to the point about leaky gut, I'm almost not surprised at all by that, just because
No,
number one, all of
no,
us in some form or fashion is going to face that at some point in our lives because
sure.
we're not educated on this at all. And what's
That's right.
so
That's right.
fascinating is the development of our microbiome and, the diversity of it and so forth. I mean, starts as early as the day you're born, right? So
Right.
how you're birthed
Absolutely.
into this world, determines that. So
Extremely
just
important.
exactly right. So to me, it's just we all are gonna it's kind of like we're all gonna be on a gut healing journey at some point or
Absolutely.
another
Yeah.
in our lives.
No doubt about it. No
Yeah,
doubt
but
about
that's
it.
kind of
Yeah.
how it has to be, right? Because in order
Right.
for us to even consider our gut, we have to know about our gut. We have to be
Right.
educated on it. We have to understand what that means.
That's
So
right.
we have to find the knowledge or the practitioner, the resources in order to educate us and to really identify it as being whatever it is, dysbiosis or, whatever issue that might be there, right? And then from there, it's about taking the necessary steps to address it. But I just think what's problematic about it is having absolutely no understanding of this because no one is telling us about it unless we're going about it on our own. And
Right.
we're thinking, oh, I'm eating, Activia yogurt, so I'm okay, I'm good,
Right.
right?
Right.
Like
Right.
that doesn't mean that we still don't need to do some digging and see what's underneath the surface. So I'm very, very passionate about this topic because like how can we know something when we just don't know? You can't, right? And
You
so
can. Right. Right.
luckily I think there's more conversation happening around it and
Sure.
obviously the work
More
that you're
awareness.
doing and the
Yeah.
awareness piece absolutely, but it's so hard to understand how it's so neglected and so overlooked. And Hippocrates said all disease begins in the gut. So we've known about this. We've known about this.
For thousands of
So,
years.
well,
Yeah.
exactly. So why
Yeah.
it's not more commonplace is just what's really irritating given how connected it is to what you're saying about all these other areas. For me personally, the gut brain connection and
Right.
acknowledging the relationship between what's going on in our gut and anxiety and depression and so forth. I mean, it is just so important. So it just feels so disconnected, and that's what's so irritating, I guess,
Very.
to confront time and time again, you know?
Yeah. And it's complicated. The gut, we know we don't know a lot about the gut,
Sure,
in the big picture. We're
sure.
still learning. So yeah, it is neglected a lot, particularly from allopathic side, from medical side. They don't really talk about the gut much unless you have a disease, you
Hmm.
know. Then they'll try to help you in some fashion. But giving antacids and
Yeah,
just telling you to take Tums or whatever,
yeah,
it's just
yeah,
ridiculous.
yeah.
That's not the answer. And the diet's a big part of it, as you know. Stress management is a big part of it.
Sure.
But finding the source, correcting dysbiosis, correcting leaky gut, we do that, things get better.
Yeah.
Things definitely
Yeah.
get better.
For sure. Yeah, and I'm glad that you also mentioned the fact that they can be digestive in nature and they can also not be digestive in nature. So that also makes
Right?
it a little bit harder for the average person, I think, to maybe conceptualize, you know?
Yeah. I mean, I saw a lot of that. People come in to me and they know I'm a chiropractor, like, well, my joints hurt. Why do you think's going on? I'm like, well, it's probably your gut. And they go, what? What
Yeah.
are you talking about? I'm like, yeah, it's
Yeah.
probably your gut. And then, no,
Right.
no, my gut's fine. I don't have any symptoms there. And like, no, you have joint
Joint
pain
pain. Yeah,
because of
which
the
is, yeah.
inflammation. That is your gut symptom, or you have
Right.
brain fog or whatever. You know what I
Right.
mean? And they don't relate it because they don't understand. And, maybe that's not their job, but they're surprised by that. Well, how could it be my gut? My gut's fine. I poop
Right.
every day, I'm
Yeah.
good.
Yeah.
Well,
Yeah.
we'll see.
Yeah. Well, yeah, we'll see.
We'll see. Yeah.
Listen, we'll
Try
see.
this and
Let's
see
do
what
some
happens.
testing and we'll see what we
Yeah, we'll see what
find. Yeah.
happens. That's right. That's right.
So, what would you say are the top three nutritional takeaways that someone can implement today, tomorrow, the next day, that you would suggest to anyone for better health? This can be, it's a very vague and broad question, but, whether it's, relinquishing consumption of certain foods or incorporating, I love more of the crowd out approach because I think that that helps us mentally to warm up to the idea of shifting our nutritional choices. But whatever you think is most valuable, what most important for someone to improve their health.
Well, I agree with getting, you always remove the source,
Sure.
right? So if there's something bad in your diet, toxin wise, you remove the source. I mean, that's
Sure.
ridiculous to think you're going to heal anything if you
By
don't get rid of
keeping,
the source.
yeah.
So I think that is number one. But from a strict standpoint of just nutrition,
Yeah.
what I see people that they're lacking in their protein intake,
Yeah.
particularly women, are lacking in the protein intake. We're lacking in our healthy fats,
Yeah.
particularly our omega-3s, big time. And we're lacking in fiber intake.
Mm,
Those are probably the three main areas I see where if people just did those things,
yeah.
they're going to start to heal better
Yeah.
and feel better. Now, there's a long list of things after that that I would
Yeah.
work on too.
Yeah.
But, just the basic things, we need those amino acids every
Yeah.
day, the essential amino acids and the healthy fats and fiber. I
Yeah.
think that's really missing in people's diets in
Yeah.
those areas.
And I love that because it's so accessible,
Yeah,
and
right,
I see this too, where, women are fearful to eat too much protein, whether it's a
right,
calorie issue or I don't want to get bulky or whatever the concern is. Fat, we've
right.
been told, indoctrinated to fear fat, and
That's right.
fiber, we're just not eating enough plant-based whole real foods that
There
contain
you go.
abundance of fiber, right? So
That's right.
it's understood and it's also very easy. And I'm cautioning myself to use the word easy because I know access
Yeah,
is really important to
it's not always
consider.
easy.
Yeah,
Right,
it's not always
right.
easy. And so
Yeah,
I don't want to speak to that entirely in the sense that, oh, just do it. It's easy because it's not. But I think it leaves room for flexibility because you're not saying eat this one superfood, eat this
that's right.
one,
Doesn't exist.
it doesn't exist. Exactly. It's an
Right, right,
array of different diversity,
right.
it's an array of different types of foods and, incorporating more protein, incorporating healthier fats, incorporating, more fiber gives umbrellas for everyone to then decide, okay, what does this look like for me? How can I
That's right.
make this part of my lifestyle and my life? And I think
Exactly.
that is so important because we've become so obsessed with this one size fits all. Well, so and so's only eating this and so and so's only,
Right.
and it really isn't like that, at the end of the day, and nor is it sustainable if you're trying to follow some sort of
Exactly.
program
That's
that
right.
works for someone else and now you're trying to fit it into your lifestyle and it's just
That's
not
right.
working, but you're like,
Yeah.
oh, but it worked for them, so it's going to work for me.
And I've been on those kicks. I did, the keto thing for a long time, and I
Hmm.
did intermittent fasting for a long time, and carnivore, and I did all these things trying to figure out. A lot of times because I want to experiment, so I can know how to help my
Yeah,
clients, right?
sure. Yeah.
But like, why? If I tell them to do it, I better have done it,
Yeah.
in the
Yeah.
past. But it always comes back to the basics,
Yeah.
just eating the rainbow of foods, getting healthy protein in, healthy fats, trying to avoid all the toxins that you possibly can, whatever that is in your life.
Yeah.
And just doing that on a consistent basis. And then you can have these moments, where you celebrate or you go,
Yes.
on a
Yeah.
particular diet for a little bit.
Yeah.
I do believe in traumatic stress being a positive thing,
Yes. Love that.
so I think, so we can have that in our life. And I think it's important. So there's a time for fasting, there's a time for keto, there's a time for these things. But like you said, there's no one size fits all and not everything works for everybody.
Sure.
And I've done that. I've put people on keto many, many years ago and failed miserably.
Yeah.
So,
Yeah.
and so forth. So I don't do that anymore.
Okay.
Yeah, do that
Yeah.
anymore.
So you
Yeah,
learned from that experience.
I
Yeah.
learned the hard way. Yeah,
Yeah. But when you think about it too, I mean, maybe years ago that was trendy and that was, how we were operating as I don't, you can speak to this, but I think we've come a long way and we still have ways to go. But in terms
yeah,
of these diet trends versus let's just eat whole real foods and find what works for my body versus your body versus the
correct.
next person's body and
That's right.
stick with that in
Yep,
a more reasonable way,
that's
you
right.
know?
And just takes time. It's time consuming. It's
Sure.
to figure that out, but it's the best way. It's
Yeah.
absolutely the best way.
Sure. Yeah, couldn't agree with you more.
Yeah.
So you've mentioned it quite a few times throughout this whole conversation about stress and health.
Yeah.
And you and I have spoken on stress too, and how, stress comes in a different form and fashion for everyone. It's not just psychological stress, but there's also physiological stressors. It's the way
Right.
we're living our lives. It's stressors that were in our childhood, like traumatic stress, or just stressors of the world, things out of our
Yep.
control. So
Yeah.
I guess just in a nutshell, I'd love for you to speak a little bit about on stress and health and the relationship that's there.
That's the number one reason why people see me
Yeah.
is because they don't have a good stress response. We can't eliminate stress, right?
Mm,
Stress is going to be there, but
sure.
the stress response, HPA axis, cortisol, the whole bit, it's just not healthy.
Yeah.
And we test that cortisol awakening response. We test the HPA axis. We need to know what the adrenals are doing,
Yeah.
so, but it's the number one reason why people seek help, I
Yeah.
believe. And it's only getting worse. It's not getting better, as far as the stressors put on our body.
Sure.
And, like you said, physical, emotional, EMFs, the computers, all the
Oh,
things that
yeah.
just are being bombarded every day,
Yeah.
and we have to have a stronger stress response now than ever before, I believe.
Yeah.
And most people are just lacking that big time,
Yeah. Yeah.
big time.
Yeah. I love that you're saying, we can't control the stress
Mm-mm.
because the second that we
No,
try to do that is going to be it's going to
not
be more
possible.
stress.
That's
It's going
right.
to be more
That's right.
stress on top of
Yeah,
but it's about building your resilience and building your body's ability to respond to it. And I think that
exactly.
that is what's missing in the sense of we're not eating the right foods, we're not exposing ourselves to what you're saying about hormetic stressors and,
Right.
um, building our body and our brain's ability to respond more effectively to it. And then we're seeing it wreak havoc on our health through what you're saying in terms of like cortisol and so forth. And then that's
Right.
furthering compromise.
Right.
And then it's just this vicious cycle that, we can't step out of. And I
That's
think
right.
what's most challenging is stress is so intangible. So it's not like I can say like, oh, eat this food or do this activity or, sleep 8 hours.
Right.
It's so hard for people to number one, identify stress because I think we've normalized a lot of the stress that we
Yep.
experience. It's
Yep.
hard for people to address the stressors and setting boundaries with their stressors because
That's right.
that's life, right? I have kids, I have responsibilities, I have a job. How am I supposed to stop any of these things?
Right. Right.
And then also just general knowledge about what you're saying about cortisol, and then the impact of the foods that we're eating and the physiological stressors that bring stress to the body. I mean, it is just such a cumbersome conversation to be had.
Yeah.
And
Yeah.
I feel very strongly, as you know, about this. And I think
Yeah.
it's just so unfortunate because I know that they say 95% of illness is caused by or exacerbated by stress. And
Absolutely.
so for
Yeah.
us to not spend more time discussing that, exploring that, and understanding that in our world is kind of foolish, at least in my,
That's right.
my opinion.
Absolutely. And the first assessment that I do give my clients is a stress assessment, a
Okay.
questionnaire.
Yeah.
I need to know. I need
Yeah.
to know where the stress is coming from. Can we eliminate it? Is it possible to eliminate it?
Sure.
Or do we just have to deal with it?
Yeah.
Whatever fashion. So I think it's huge. It's
Yeah.
absolutely one. Absolutely number one.
Yeah. Yeah. Well, I am hopeful that, we continue to, especially as the world of mental health, I think becomes a little bit more discussed and
Yeah.
explored and considered in relation to general health and obviously the stigma still exists, but I think we've definitely come a long way in terms of opening the door for conversation around it. I'm hopeful that
Absolutely.
that does a lot for the sake of what you and I just discussed and the impact that it has. Because I simply don't think that people are cognizant of that piece of the puzzle. It's like you can eat the right foods, you could do all the right things, quote unquote, once again.
Right.
But it's that stress piece. If you can't look at that and really address that, you're really only doing so much, or maybe you're not doing anything at all because of what
That's
stress
right.
does to our gut and the burden it places on our health.
That's right. When we help people balance their HPA axis,
Okay.
and after a couple months of doing that, and then they come back, they're like, wow, I didn't
Yeah.
realize the impact, how my body wasn't handling the
Sure.
stress. The stress
Sure.
is still there. I can't get rid of their job or whatever,
Yeah. Yeah.
but how their body responds to that. So once we reset that axis, once we know how it's off,
Sure.
because it can be, there's different stages of the stress response and so forth. But once we balance that, life is
Yeah.
totally different,
Yeah.
so much better.
Right. And probably a life people didn't even know could exist,
They
because they've
they
been
didn't
living
have
it
they had no
for so
clue.
long. Yeah.
Yeah, they had no clue. They had no
Totally.
clue. They just thought that, well, that's just normal, whatever
Yeah.
their symptoms were, because the symptoms vary from person to
Sure.
person.
Sure.
But what's going on with the cortisol pattern throughout the day and what the adrenals are doing, we can figure that out.
Yeah. That's amazing. I love
Yeah.
that. That gets me so excited and happy. I
It is
just think it's so
exciting. Yeah.
important. So Tony, this has been so wonderful and lovely. I would love for you to
Yes,
share a little
nice.
bit about where everyone can find you and how they can connect with you.
Sure. So the name of my practice is called UB Well Center for Holistic Health, and that's spelled with the letter U and the letter B and then the word well. So ubwellcenter.com, on Facebook, UB Well Center. On Instagram, I'm Dr. Tony Blasco. Same thing on YouTube.
Okay.
So that's kind of where I hang out on social media anyway. You can find me
Yeah.
there. I have a
Yeah.
webinar on my website that they can watch all about stress and gut health.
Love
And they
that.
can just click on that, and about a 20-minute webinar that I do. So anybody can
Okay.
watch that if they're interested. Yeah.
Very cool. Very cool. Well,
Yeah.
thank you so much for being here today.
Thanks for having me.
Yes, I'm so grateful, for your knowledge and your experience and expertise and what you can offer. And I'm hopeful that this isn't the last time that you'll join us here on
Um,
the podcast.
be my pleasure to come back.
Yes, thank you so much. And thank you to everyone who has tuned in today. I will put all of Tony's information in the show notes so you can connect with him over social media or check out his website. And thank you for being here. And I hope you'll join me next time. And in the meantime, be well.